Greetings and welcome to week 4. Let's talk about the increasing use of technology in healthcare. We all know that healthcare costs are rising, and they're doing it for several reasons. The use of new technology for medicine, such as procedures, treatments, they've increased patient survival and the cost of medical care. Uh, and the aging population. As the population ages, spending on healthcare rises. Um, we're using technology to track patient treatments and outcomes, which leads to development of quality standards that we have to meet. Um, Technology has made it possible for primary care providers and specialists to confer while looking at the same CT scan on a computer, even when they're miles apart. Because, a lot of times uh, it has to be done separately and filed separately. Um, Healthcare information technology, or what we call HIT, is technology that's used to record, store, and manage patient healthcare information. Uh, Technology is used to perform tasks such as clinical tasks, like recording vital signs or ordering medications, administrative tasks such as scheduling appointments or creating insurance claims. We have the PMP, or Practice Management Program, which is the software program that automates many of the administrative and financial tasks in a medical practice setting. This includes verifying insurance eligibility and benefits, um, organizing patient and payer information, generating and transmitting insurance claims, monitoring the status of claims, recording payments for payers, generating patient statements, posting payments, updating accounts, managing collections activities, creating financial and productivity reports. So it does quite a bit. Now, when we talk about creating and transmitting claims, one of the most important functions of a PMP is to create and transmit healthcare claims. It collects information from a variety of databases. Uh, and we all know that a database is just simply an organized collection of information about the patient, the provider, the health plan, and facility, and well, more actually. Uh, it monitors claim status to ensure prompt payment of claims. It's used to follow up on status of claims. In other words, an electronic message can be sent to the health plan, to ask what the holdup is. PMP receives document that lists the amount that's been paid for each claim and reasons for non-payment or partial payment of the claims, because we know sometimes the insurance company will pay nothing. They will pay 20%, 50%, 80%. Very seldom will they pay 100%, but sometimes they do. So we need to know why, because it could be the fact that we just entered something incorrectly, and then we just correct it and send it back. There's also EHRs, or electronic health records. It's a computerized lifelong healthcare record for an individual that incorporates data from all providers who treat the patient. Documentation is a record of the healthcare encounters between the provider and the patient. And the EMR or electronic medical record, is the computerized record of one physician's encounter with a patient over a period of time. We have PHRs, or personal health records. These are private, secure electronic files that are created, maintained, and owned by the patient. The Institute of Medicine suggests that an EHR should include health information and data elements, results management, order management, decision support, administrative support, reporting, and population health. Okay, health information and data elements. We're talking demographic information like address, phone numbers, patient's name, age, uh, clinical information about the patient's past and present health concerns, such as a problem list, signs, a list of signs and symptoms, diagnoses, procedures, treatment plan, medications list, allergies, diagnostic test results, radiology results, health maintenance status, and any advanced directives that they might have. So results management is computerized results which can be accessed by multiple providers when and where they're needed. And order management is staff members in different offices and facilities can access orders, which eliminates a lot of unnecessary delays and duplicate testings and all that stuff. So in other words, if you went to this doctor this week and he ran blood tests, you go to another doctor next week and he wants to run blood tests and he knows that you've just had blood tests, and he will request those. Or it might be your insurance may require you to be in this circle of providers. And if so, those providers can access the information. Decision support. An EHR gives physicians immediate access to clinical research on diagnoses, treatment, and medications. We have electronic communication and connectivity. This is physicians, nurses, medical assistants, referring doctors, testing facilities, and hospitals. These people can all communicate with one another through a number of mechanisms within the EHR. And then we have patient support, which offers patients access to educational materials and instructions for tests, as well as the ability to report, home monitoring, in other words. Administrative process or processes. PMPs and EHRs streamline billing and scheduling and other of the administrative tasks, and they're a little easier to produce. Reporting and population management. It's also enhanced by EHRs for reporting capabilities to make it easier to comply with federal, state, and private reporting requirements. Advantages of having an EHR. One, safety. You have reduced medication and physician order errors. You get instant alerts about patient allergies and drug interactions. Alerts when medications are unsafe. There's no risk of records being lost due to, say, a natural disaster. You have improved communication related to an outbreak of disease. The quality. Patients are reminded about preventative care screenings, They're able to monitor chronic disease at home and report the results via the internet, send an email or message. The patients can review data about the quality and performance of the providers prior to obtaining health care from them. Efficiency. Um, Improved workflow in the physician practice or hospital, speedy delivery of diagnostic test results, the ability for 2 or more people to work with a patient's record at the same time, uh, never need to search for misplaced or lost patient chart. A summary of the patient's health information is available at a glance. Reduced time to refill prescriptions through electronic prescribing. All important available information is in one place. And payments for services received can be more quickly acquired. Excuse me. Um, there is the medication documentation and billing cycle, which is a 10-step process that results in timely payment for medical services. Okay, there's step 1, pre-register patients. Makes sense, doesn't it? Gather the information to pre-register the patients before the office visit, such as the name, the contact information, address, phone number, the reason for the visit, the patient's status. Are they new or are they an established patient? Step 2 is to establish the financial responsibility. Determine whether the patient has insurance and obtain the identification number, the plan name, the name of the policyholder. If they don't have insurance, establish the patient's planned method of payment. Are they going to pay by check? Are they going to use like a healthcare card like Care Credit to pay for it? Check in the patients. A patient information form is a form that includes the patient's personal, employment, and insurance data needed to complete their insurance claim. Verify the identity by photocopying and scanning the patient's insurance card and photo ID. Check in the patient step 3, or continue with that. Distribute the financial policy and privacy policy, collect time of service payments. For instance, like with insurance, sometimes you'll have a $10 copay, $20 copay, $25 copay, $75, whatever that is, you collect that. Review the coding compliance, diagnosis and procedures. We know that a diagnosis is the physician's opinion of the nature of the patient's illness. The procedures are the medical services that were provided. Coding is the process of translating a description of a diagnosis or a procedure into a standardized code. The diagnosis code is a standardized value that represents a patient's illness, signs, and symptoms. 4, procedure code is a code that identifies medical service, and it's obtained using the CPT. The CPT is just a standard classification system for reporting medical procedures and services. Then you have the HCPCS, and you've got the ICD-9-CM and ICD-10-CM, which after October 1st, 2014, people started using that. You also have an encounter form, which is a list of common procedures and diagnoses for a patient's visit. Review billing compliance. Each charge or fee for a visit is represented by a specific procedure code. The provider's fees for the service are listed on the medical practices fee schedule, and the medical billers medical billers will use their knowledge to analyze what can be billed in a healthcare claim. You check the patients out, which is step 6. You got the medical codes have been assigned and checked. The type of charges usually collected at the time of service will include previous balance, co-payments or co-insurance, non-covered services, charges of non-participating providers, charges for self-pay patients, and then deductibles. Step 7, you prepare and transmit the claims. Once the patient and the transmission information is entered into the PMP, the software is used to create an insurance claim form. Then it has to be sent to a clearinghouse, which is a company that collects the electronic insurance claims from medical practices and then forwards the claims to the appropriate health plans. Step 8, we want to monitor the payer adjudication. So when a claim is received by a payer, it's reviewed following a process known as adjudication, which is a series of steps designed to judge whether it should be paid or not. The document explaining the results of the adjudication process is called a remittance advice, or RA, or explanation of benefits, or what we call an EOB. For each RA and EOB payment, you check to see that all the procedures are listed on the claim, unpaid charges are explained, codes match the claim, and the payment is as expected. Step 9, we generate the patient statements. The statements will list the services performed and the remaining balance. That's the responsibility of the patient, if there is any. Step 10, we follow up on payments and collections. So we use what's called revenue cycle management, which is managing the activities associated with a patient encounter to ensure the provider receives full payment for the services. There are, quite a few steps to making sure that everything is as it should be. Let's talk about the impact of legislation, or HIPAA. The Health Insurance Portability and Accountability Act of 1996, or what we call HIPAA, HIPAA, contains a number of rules which include the HIPAA Electronic Transaction and Code Set Standards, the HIPAA Privacy Rule, the Security Rule, and Final Enforcement Rule. HIPAA Electronic Transition and Code Set Standards. These will describe an electronic format that provides the health plans must use to send and receive healthcare transactions. So they got to use these. And the electronic transmission of data is called Electronic Data Interchange, which is EDI. And payment may be via electronic funds transfer, or EFT. So you're allowed to transfer your funds accordingly. Claim formats, you'll have the HIPAA standard, which is X12-837 healthcare claim, or the 837P for short. The CMS-1500 paper claim, the National Provider Identifier will be listed, which is the 10-position numeric identifier consisting of all numbers. Uh, we know HIPAA protects the individually identifiable information about a patient's health and payment for the health care that's created or received by the healthcare provider. The rule mandates that a set of privacy practices are adopted. Patients are notified about their privacy and how their information can be used or disclosed. Employees are trained to understand the privacy practices. Staff members appointed as a privacy official. And the patient records that contain healthcare information must be secured. So there is a lot that goes along with HIPAA. Uh, and with processing of electronic files and all that. Just make sure that you follow the steps and that you follow HIPAA. HIPAA is critical. I mean, sometimes it might feel like it's a pain, but things like talking about patients' care. You can only talk to the people that are involved in that patient and their care. You can't unless the doctor seeks a second opinion or asks a professional, let's say a cardiologist to look at a ECG and see what he thinks. Then he has become a part of that group. But you can't talk outside of that group. You can't talk to your friend who works on another floor about a patient or anything like that. So you have to be very careful. All right, that's it for this week, and I will look forward to seeing you next week. Have a good day.